All right. Hello, everyone. Welcome to our Nourish to Flourish webinar. If this is your first time joining us, we're so glad to have you. If you've joined us before, welcome back. My name is Kelsey, and I'm one of the clinical dietitians with the Stanford Lifestyle and Weight Management Clinic, and I'll be your moderator for today's session. Today's webinar is being recorded, and it will be posted on the Stanford Health Library under Lifestyle and Weight Management Recorded Lectures, along with PowerPoint slides. You'll also receive an email after this session with a link to the recording. If you have any questions, please add them to the Q&A chat box located at the bottom of your screen, and we'll review those with our presenter during the Q&A portion of today's webinar. Now I have the pleasure of introducing my colleague, Shirley Siu, who is today's presenter. Shirley is a registered dietitian, nutritionist, and board-certified specialist in obesity and weight management. As a dedicated member of our multidisciplinary team at the Stanford Lifestyle Weight Management Center for the past 6 years, Shirley has provided personalized counseling to a diverse range of patients. Her expertise lies in developing tailored strategies that promote health and wellness, emphasizing individualized lifestyle modifications and practical nutrition plans that empower patients to achieve their goals. Shirley is presenting to us today Vitamins and Minerals Unpacked, your guide to the nutrient powerhouses, and we'll explore some essential information about vitamins and minerals, focusing on commonly supplemented nutrients for the average adult, and learn more about micronutrient-rich foods and how to incorporate those into your daily diet and promote optimal health. So with that, Shirley, take it away.
Thank you for the introduction, Kelsey. I'm very excited about this topic today, simply because it allowed me to deep dive and learn more about what vitamins and minerals really do. But before I get started, I'd like to take a poll from the audience. Which vitamin or mineral supplement do you take routinely? And you can join by the QR code, scanning with your camera app, or join by web using the pollev.com and /Natalie $637. I'll give you about few minutes to join the poll.
Shirley, it appears that the poll is locked.
Oh.
And I'm not able to unlock it at this time. Maybe if people want to add some of their words to the chat box, I can read them aloud.
Thank you, Kelsey. Apologize for that.
All right, I'm hearing folic acid, I'm hearing multivitamins, I'm hearing creatine, I'm hearing some vitamin D as well.
Sounds good. There are some very popular vitamin supplements there. Magnesium is definitely a very popular one these days. And I apologize for the poll not working, but thank you, Kelsey, for letting us know what the responses would have been. Okay, with that, let's get the definition right. For those of you who are familiar with what macronutrients are, on one of our previous webinars, we talked about protein, carbohydrates, and fat, which are the macronutrients providing energy. So vitamins and minerals, we consider micronutrients, right? We need them in very small amounts, but they are needed, required by our bodies to carry out numerous, essentially pretty much all the standard, very important body functions. And we do need to derive it from diet, meaning we are unable to really produce, either unable to produce at all or not enough where it will maintain the levels needed for health. And one really very important aspect I want to start off with, which is a little a sneak peek, is the way that vitamins and minerals are managed in us is the absorption and the way that we utilize them are strongly influenced by how much that we have. So the concentration in our body tissues in order to maintain that balance, right? Uh, with vitamins are the organic compounds that are present in animal and plants. They are broken down into two categories, which I'll go over in a minute. And the minerals are actually the inorganic elements present in soil and water. Typically, in that case, will be absorbed by plants. And when we consume said plants and animals, that's where we'll get the minerals as well. So through diet and through consumption. The first category of fat-soluble vitamins. So we call them fat-soluble because they are stored in their fatty tissues and liver. At the same time, in order to absorb them properly, also requires a source of dietary fat at the same time. So oftentimes they are going to be in foods that are have already present in foods that have fat in them. But though there are sources of vitamin A and E in plant sources. So the four fat-soluble vitamins is A, D, E, and K, or ADEC for short. The amount of dietary reference intakes that are listed here are based on it's a reference value used to plan and assess nutrient intakes for healthy people. So typically RDA is the recommended dietary allowance. And so there's two, if there are levels established, it will be RDA, and the other would be average intake. So that's the amount determined that you need in a minimum amount to maintain health from your diet. So for vitamin A, as you can see some of the very important functions here. It's involved in vision, epithelial cell regulation, some more some wound healing, bone health. And so a lot of these are shared functions if you look at the other fat-soluble vitamins as well, like vitamin D. Also, and of course, we know is very important in bone health, calcium absorption and pain. Actually, they work synonymously together. Vitamin E maintains cell membrane integrity, helping to form the cells themselves. Of course, having antioxidant properties, so skin health, and vitamin K, bone health as well. As you can see, those four, they all have 3 out of 4 have bone health as a very important function they're part of. And vitamin K additionally also blood clotting as well. So because they are stored in fatty tissues and liver, excess intake of it, typically from supplementation, right, separate and generally in very high doses is available on the market, or can be toxic. But dietary intake of vitamin A and E, in studies, not supplements form, have been studied and associated with reduced risk of cardiovascular disease. So all of that says, if you're taking fat-soluble vitamins for health, reducing risk of disease and infections, that the food source of it has been shown to help you reach that goal. Water-soluble vitamins, there are many. They come down to the 8B vitamins, which are probably better known with some of the names as a folate or biotin too, that are very popular choices for supplementation. And vitamin C as well is also very popular for supplementation. Since they must be dissolved in water before absorption by the body, they're not stored, right? And excess amounts of it, whether it's generally very high doses in supplementation, really the unused amounts, most of it is going to be excreted through urine. So they're not stored. That also means it requires regular consumption as part of your diet. For developed countries where you have sources of foods, which we'll go over in a minute, is deficiencies are not very common for folks who are able to absorb nutrients and food normally. You can see the RDAs exist for most of them. They're very similar, but the amounts are very, very low. They're measured in milligrams, and right now I only listed the amounts dietary reference intakes for adult men and women between the ages of 19 and 50. Because for older adults and of course children, that amount is a bit different. Vitamin C, which I know many people take around the time we're near at flu season to help boost their immune functions. It does have that property, but it's been used a lot. And other B vitamins also heavily involved in immune function here. Once I started looking more into them, I realized they all share multiple functions, right? So they do, some of them work synonymously with each other, such as folate and B12 or cobalamin. They work together. One feeds to is needed for maintaining the other. So a lot of the B vitamins work together this way. They are heavily involved in energy metabolism as well. So a lot of people take B vitamins for energy, right? But again, going back to, it's really rare to have deficiencies when you when you only need a very small amount of it to maintain that normal level. So any extra you take in through, whether it's you take your vitamins or in vitamin water and various things, really is just going to be wasted. However, on the next category here, lastly, is common and trace minerals, right? Oftentimes, vitamins and minerals are in the same conversation, in the same supplements. When you look at a typical multivitamin, they might have some minerals, but a majority of them are going to be predominantly the two different types of vitamins we've talked about so far. Whereas minerals, I did not list all of them here, but the core ones where most people are more familiar with, like calcium, potassium, sodium, and magnesium, otherwise known as electrolytes. We require a good amount of it because it's constantly being used in just maintaining almost every single function that we have available. Fluid balance, they are stored, but within intra and extracellular, inside our cells, in body tissues, and they are heavily regulated by our endocrine and intestinal system to maintain that balance, because it is so crucial that balance is achieved. Otherwise, some very significant health issues will occur when your common minerals and electrolytes are out of balance, right? The trace minerals are the iron, zinc, copper, and many others, such as fluoride, manganese. Those are needed in much, much smaller amounts, but also, and of course, very important for, many of you know, as iron is important for maintaining oxygen transport, red blood cell health, so many other different things. We need them in very small amounts. Now, the trace minerals, they actually interact with one another, and also with the electrolytes or the common minerals themselves. So I often caution for trace minerals to really be careful how much that you choose to supplement, if you do choose to supplement, we have just such a system of maintaining this, and it can definitely be toxic, right? Majority of it we're going to get from, again, plants, which the plants have absorbed a lot of it from the soil, and animals who consume said plants. So that amount can vary, but we need a very, very small amount of it, milligrams of it per day. You can easily consume that amount for most people to prevent deficiencies, which is the goal here, preventing deficiencies, ultimately to protect your health. Okay, so food sources. After all of that about the functions and what it really does, like, okay, where are they really? They're in our food. I mentioned they're in plants, they're in animals. But as I was putting together this list, and there are a lot of tables telling you which food has what, but if you look at each category, and I based this on the USDA dietary guidelines and categorizing the foods on a balanced diet. If you look at each category, vitamins, minerals, both water soluble and fat soluble vitamins, they are present in each category, meaning following the general guidelines in consuming whole food sources, quality sources of food, different types of protein, varying your protein, different types of fats and oils, nuts and seeds included. You can see how you can be able to get the right amount of vitamins and minerals to maintain your own health. Now, the message I really wanted to get across is, in this current climate where groceries and there's so much more increased costs, like, there are certain things that focusing on for your health, which is you want to be able to prioritize maintaining your health with both eating a well-balanced diet which will give you what you need in terms of minerals and vitamins. Well-balanced diet found the My Plate method, a variety, half your plate of fruits, vegetables, whole fruits, varying different colors of vegetables, because some vegetables have higher vitamins and higher minerals. But you also, of course, get all the other components for health as well. And the grains, different types of grains, and it also varying your protein and really focusing on that balance. Now, that is if you're, of course, it is understood that not everyone is able to consume the balanced plate, right? Applied to most of the population. So supplements exist. They do exist for a good reason, where some people are not able to consume either the right amounts of food, or for some reason just cannot absorb that. So who would that be? Most of the broken down into people with chronic health conditions. A lot of it has to do with, is going to come down to people with who cannot absorb due to having had gastrointestinal surgery, such as weight loss surgery, or have some chronic gastrointestinal disorders where you are, because all of the nutrients I mentioned earlier, vitamins and minerals, rely on our intestinal tract to properly facilitate and in a complex system to get it to the place that it will be used. Kidney disease also is one of the health conditions where supplementation may be necessary. Certain medications as well. So it's really individuals who already hopefully should be being monitored and their care is managed by a healthcare team, though they will be able to tell these and help each person figure out whether they need that supplement, especially under a healthcare provider guidance, right? Sometimes on and for some individuals with dietary restrictions, where there are multiple food allergies, where entire fruit groups may be eliminated or they're not able to tolerate. The third category very commonly is pregnancy or lactation, where there are higher needs of certain nutrients that it becomes a little more difficult. And you want to make sure both, maternal and fetal health is maintained. So you want to, so things like prenatal vitamins are necessary, folate for those who are considering grandchildren to help with the neural tube, prevent neural tube defects. Lastly is also known history of deficiencies. And it may be from due to one or more of these particular examples, but there is known history of deficiencies, whether or not that's been whether or not the reasons for that deficiency has been determined is something that requires monitoring at the same time. When you start a supplement, it requires monitoring and likely continue supplement until that cause is determined and corrected. Some of these are commonly B12, iron, vitamin D, which many people are, I think 9 out of 10 clients I meet with tend to have a low vitamin D because there's not a lot of dietary sources for that. Okay, so if you've been counseled or you have a history of deficiency, you've been advised by your healthcare team or your doctor or your dietitian that you should take a supplement. Hopefully they give you some guidance as to how much. As you're shopping, there's on the internet, there's so many different types. When I go down, walk down to drugstore, large grocery stores, there's entire aisles of this. Like, what do you do? How do you pick the one that is a good product? Unfortunately, supplements, vitamin supplements in the supplement category is not regulated like medications or food. Their sources aren't, tracked or traced or tested before being released to the market. So, it should be cautionary and choose reputable companies. I mean, as long as the companies that's been around for a while, where you can actually look to see if they have any concerning previous products, perhaps. Try to find one that has a third party testing label. So these are some of the labels you may find on some of these products. There's this USP Verify, where essentially it's saying that a product that's been USP verified has been declared, like the potency has been declared as free from harmful contaminants. It doesn't contain unsafe levels of certain contaminants such as heavy metals. When I pick up a bottle of a vitamin and mineral, I don't. Many of them often don't have one of these. So if you're able to, you want to choose one that has one of these certifications, so they've been tested. Consumer Labs also want an NSF as well. And hopefully, if you've been advised to take a supplement to help treat or to prevent a deficiency, you've been provided a amount or recommended dosage. So you want to find the amount that's been recommended to you. So you take the serving size, the amount that's been recommended for you, because your healthcare team has determined that is the amount that will maintain your health or improve your levels. This part is a little bit tricky, but if you are on multiple medications, there are at times some supplement medication interaction. Now, pharmacists do have that long uh, interaction printout that they give with medications do offer some guidance on that. So it is worth it to either take a look at that or ask if you're starting medication or if you're starting a supplement and you are on a few medications, you want to know if they're interacting. They don't always, because they don't know, since supplements aren't tracked necessarily in your health record because you take it over the counter, your pharmacist won't know versus when you take medications, if it's at the same source, they can check that interaction for you. So it's important that your care team's aware when you start a supplement, you're thinking about starting a supplement. Lastly, continuing following up, because if you're treating a deficiency or asked to take a supplement or recommended uh, to treat the deficiency or prevent that, um, surveillance, that is, follow-up blood testing is needed. So don't forget to do that so that we know if the amount is working. Because sometimes necessarily the way that vitamins and minerals are managed in our bodies, it's sometimes the amount that's recommended may not be sufficient to help correct some of those deficiencies. So thank you for listening to that. Is there opening up for questions?
Thank you, Shirley. That was very helpful, and paring down some of that information that is sometimes overloaded with online and social media and what you should and shouldn't take. We do have a couple of questions in the Q&A box, but if you have any others, feel free to type them in and I'll share them with Shirley. The first one is, I take 0 supplements and I get all nutrients from your vitamin or from food sources. Often a number of my vitamin and minerals go above the RDA. Are there any I should be concerned about overdosing on from food?
Oh, that is a good question. So you're not taking any supplements that you feel like you're um, getting above the RDA. I would say the risk is low on that. As I said in the beginning, when you get the levels in your body is sufficient, normal, the absorption, the way that the system works is, the absorption is reduced, and it's when it's from food, because the amounts are so small, your body is able to manage it. When it's in a supplement form, it's a lot harder, not always able to manage and reduce that absorption. But from food, I think that that risk is going to be low.
Great. Thank you, Shirley. The next question we have is, could you discuss the different types of magnesium supplements? I've heard that it's good for sleep and leg cramps.
You know, I delve into that a bit at various points. I want to say the research on that is, as with most supplements, is it's uh, uh, it's not quite clear and not always conclusive. I would say there's one thing is with magnesium, that the dose that you choose should not be higher starting than 250, since the adverse effects of dosing higher magnesium has been shown to occur at above 250, which it can be rather unpleasant. But there are different types of magnesium. It just sounds like the question you're asking. I can't say for sure which each of them it's like magnesium glycinate. When someone wants to start a product, I look to see if there are, some of them are a little more absorbable, but ultimately they are supposed to tell you the amount of elemental magnesium that is in each product, regardless of the type. So when I say 250, I mean the elemental amount that's listed on the supplement. So regardless of the type, some of them may be designed to be more absorptive, but I don't know offhand whether which particular form of salt that is in is better than in another.
Thank you. Another question, is there any recommendation for anti-aging supplements or maybe some supplements that will help us age better?
Uh, hmm. Honestly, I wish there were. But if, you know, anti-aging in a type of, if we're talking herbal vitamins and minerals here, the topic being what it is, that's a very complex and broad condition where we're trying to, fight aging, which is ultimately having a good diet and physical activity wellness really has more of has been shown to promote health and including the effects of aging more so than any supplements I had ever had heard of. Perhaps at some point a team or a scientist will discover that magic ingredient, but for now it is, I would still strongly encourage, wellness, emotional health as well, sleep, stress, uh, uh, and a good balanced diet with whole food sources.
Yep, I wish there was a better vitamin for that as well. We'd all be on it. Another question is, recent DEXA scans showed some loss of bone, especially over the last few years. They're taking vitamin D with calcium and focusing on weight-bearing exercises. What else should we do? Is there anything else that they can add in?
Hmm. Um, I think also having quality protein sources, so it would be important as well. Is the way that resources are managed, including bone mass, and a portion of it, if your diet is poor in a way or being undernourished, that can way directly affect whether your bone mass is in a good place. But vitamin D and sources of calcium from your food primarily is the recommendation here to help slow that process. But typically, if it's DEXA identified, depending on the stage of bone loss, I know that there are medical pharmacology, usually managed by your endocrine provider to help slow that down. But from a diet perspective, it's about weight-bearing exercises and adequate vitamin D and getting enough calcium from calcium food sources. If you're not able to reach that at least 1,000, I believe that it's actually higher if you're, depending on what age you are, then a small supplement it can be indicated as well.
Great. Thank you, Shirley. Another question, sometimes supplements can make you feel nauseous. Any suggestions for helping with that nausea or avoiding it?
Yeah, I would first look at what kind of supplement it is. If it's a multivitamin, which, by the way, has not really been shown to improve health, but unless you need the multivitamin for reasons that you have multiple deficiencies or you have a malabsorptive condition, in that case, if they are causing you nausea, uh, I would take a look at what type they're in. Because at times, if it's a one a day, you can break that down into lower doses. And a lot of times it's the iron content. Iron seems to be an often offender. It causes a lot of the, in multivitamins, most of the gastrointestinal symptoms. So removing said iron and then having lower doses of that can be very effective there. Also taking, supplements with food, depending on, again, what type of supplement, certain foods that will, there are a few that actually certain foods will, affect the absorption of said um, vitamin and mineral supplement. So I would take a look at what type it is as well, but usually a lower dose. There are some liquid ones out there that may also be easier. They're also easier to reduce the dose on until you find where those symptoms start to occur as well. But if you can take it with food, taking it with some food will, it's the slower absorption when you are taking in that concentrated dose of that vitamin mineral that causes that symptom. So, having the food in there essentially slows down that absorption and should alleviate, and oftentimes can alleviate a lot of these symptoms.
Yeah, great tips, Shirley. We can take a couple more questions. We've got one, which type of calcium is going to be the best absorbed or the best one to take?
I am a big proponent of citrate because it's more easily absorbed, whether you take it with or without food. Um, I also would suggest starting with a lower dose as well to maximum if you, depending the amount that you've been recommended to add, trying to get again some of it from food, and then starting with say 250 and not taking more than 500 at one time. But citrate has a more absorbable form. It does cost a little bit more. If cost is an issue, other forms are also okay. In which case, taking a chewable form, non-gummy or liquid form, is can also likely be easier to absorb. It can cause, calcium carbonate, which is the more economical choice, has a little bit more incidence of constipation and versus calcium citrate as well. So that's what I would vote for.
Great, thank you. And one more. This question asks, is CoQ10 plus pepper preferred over CoQ10 without? But I think just kind of opening up that question to, are there certain vitamins that might be better absorbed with additional nutrients paired alongside them?
There are notably iron is absorption of that is enhanced by vitamin C foods or presence of acid. So having a citrus um, alongside if you're taking an iron supplement or you're eating an iron-rich food to help enhance the absorption of that. Other things include, mentioned earlier, A, D, E, and K. Those you're taking vitamin D supplement, take it with a meal that has some dietary fat. It doesn't mean it needs to be a lot of fat, just any food that contains fat, which is, it can be a plant source, ideally a plant source, but also, also meat as well. It just needs a little bit of fat and it will help enhance the absorption of that. Sure, there are others. Those are the two that most commonly uh, um, I can think of right now. Yeah.
All right, great. I know there's a lot of questions and we can't get to them all today. And there's so much to talk about when it comes to vitamins and minerals. So thank you so much, Shirley, for helping us navigate, even just this little corner of it, which was so helpful. Thank you, everybody, for attending. And a big thank you to Shirley for her engaging talk. As mentioned earlier, this recording will be posted next week on the Stanford Health Library webinar under Lifestyle and Weight Management Recorded Lectures. We look forward to seeing you again for next month for our next webinar. As a reminder, our webinars occur the third Wednesdays of every month from 5 to 5:45 or so. So join us on November 19th for Harvest Feast, Low Carbohydrate Fall Sides with our wonderful colleague, Marian. Thanks for joining, everybody.
Thank you.